I'm strong in faith.
Faith can move mountains. Radio Maria 91.3 FM.
The voice of truth.
Good evening, our beautiful listeners, and welcome to yet another Tuesday evening. And you know what Tuesday evening is all about. It's another time for us to think about our health, talk about our health. It's Healthy You on Radio Maria 91.3 FM. Again, Radio Maria, the voice of truth. So my beautiful listeners, I welcome you all again, and I hope the day has not brought its stress on us. This program is for you to just unwind that little stress and think of how you're going to live healthier and be better. Just don't think about what's the office stress, the family stress, the day stress. For a little while, just take it off your head and think of how to live a better life. That's why we're here, to just put you through and tell you one or two healthier tips on how to live healthy. So you're welcome again to Healthier You on Radio Maria 91.3 FM. Today you'll just be hearing my voice and of course my guest's voice. Ekene is unavoidably absent, and he sends his apologies to all of us. We'll pardon him for today, but I think next week we will not pardon him. So please, let's pardon him for today. Today we're going to delve into a very important topic. Something that people really don't, take cognizance of: the eyes. Today we're going to talk about something that affects the eyes, which is cataract. I have a guest with me in the studio who is going to do justice to that topic. So please stay tuned. Don't touch that dial. Make sure you listen. Take it step by step. Assimilate it. What is it about these eyes that they keep talking about? And the good thing is, she was our first ever guest on Radio Maria. In fact, the week Radio Maria started, she was here to put us through on how to live healthy and how to care for our eyes. Our guest in the studio is no other than, she's a friend, or not just a guest, because if I call her guest, that's the way she's already looking at me. She's no other than Dr. Kelechi Tabuko. She's an optometrist with the Buhari General Hospital. She's a member of Nigeria-Abuja Association. She has dropped all the plenty baggages she was carrying. President this, secretary this. She wants to rest for a while. Everybody needs it at times. But there are some people who office holding fits a lot. So Dr. Kelechi, please, can you say hello to our listeners?
Good afternoon, and thank you for having me.
And we don't just have our guests in the studio. I can't fail to not recognize the fact that our sisters are here to, in solidarity with us, to tell people to care for their eye. You know what it means for a reverend sister to come out to tell you to care for your eyes. Then you know how serious it is for your eyes to be checked and be good. So please, we have with us Sister Martha. Sister Martha, please, can we meet you?
Good afternoon. I'm Sister Mary Martha Imajoje, a sister of the Eucharistic Heart of Jesus.
Okay, the other sister is with us, but she's a little far. Sister Jacintha is also here with us. She's a friend of the house also. Sister Martha is also a friend. They are Eucharistic Heart of Jesus sisters. Sisters, you're welcome.
Thank you.
Okay, we'll go right on a short break, and when we come back, we'll introduce our topic to you. And don't touch that down, please. Truly, let love heal the world. Yes, a lot of us are carrying a lot of baggage, and it may not just be one or two things you think is giving you headache. It may just be what is within. So let love heal the world. It's a very important note for us to take home. Well, today we're going to be talking about cataracts. With me in the studio, I've introduced my guest earlier. She's Dr. Kelechi Tabuko. She's an optometrist, a seasoned one at that. She's been long in this practice, well enough to unpack our topic for the day. Our topic for the day is cataract. A lot of us must have heard about it, cataracts here and there. A lot of us are always very reluctant, going to the hospital to get these things checked. So today we have decided to bring it to you, our wonderful listeners, to tell you what you need to know, and when you need to be alarmed, and why you should always get your eyes checked. It's been estimated by World Health Organization that about 1 billion of people living in the world have visual impairments. When we mean visual impairment, we mean 1 or 2 problems with our vision that could have been treated. Out of this, 65.2 million are due to cataracts. And out of the 65.2 million people who are living with cataract, we have almost 39 million, which is 14% of the population, go blind. So that is a very serious one, and it calls for concern. Dr. K, these figures, is it really what's obtainable, or we are just getting figures, statistics? You know, at times people think statistics are just being played out, just write it there to scare people. These figures, are they really?
Yeah, they're actually real. Yeah, even at times there are places that people don't go to, they're not able to get there to get these figures.
Wow.
They are real. Just that what is happening now with the development and the new technology, a lot of people, the awareness is out there, and most people are now conscious of what is happening around them.
Wow, so these figures are real. That means, okay, people like us are already going there every now and then because we are wearing glasses. So, but that you are not wearing glasses does not mean you shouldn't get your eyes checked though. It's one day we walked into the optometrist office and they said you need glasses. So that doesn't mean that you don't have to check your eyes. Everybody must not wear glasses, but we all have to check our eyes from time to time, and that is why we're calling on everybody. That's why we bring this program to you, to walk into the clinic, walk into the eye clinic and check your eyes from time to time. Our phone lines will be open, and you know, our usual way you can call in, send your SMS or your WhatsApp messages. Please keep it in line with the topic of the day, which is cataracts, okay, and maybe any other eye issues you need to talk about. Our phone line still remains 081 084 475 18. I'll go again. 081 084 475 18. Please, listeners, we are waiting for your feedback, your observations, your complaints. Just call in, let's know you're listening, please. Thank you. So we'll delve right into our program, and we've talked about the statistics, which are a little bit scary, yeah, but it's not what we should worry about, because getting it checked is what we need to know, and how do we do that. So, Dr. K, permit me to always, you know, I always like to refer to you as Dr. K. So, for the purpose of today, I'm sure you would want us to continue with the Dr. K. I'm very okay with that. So, Dr. K, when we talk about cataracts, give us a picture. What is cataract?
Cataract is opacity of the lens, or you can call it clouding of the lens. If I will use the layman's word, the mirror of the eye, this is what enables every human being to see clearly when the light passes through the cornea down to the lens and the images are formed. So now, if the mirror of your eye, which is the lens, as I call it, is not transparent anymore, becomes opaque, it means that light cannot pass through it and you will not be able to see. That's what we call cataract. That's the opacity of the lens. Thank you.
Okay, so we've heard it that when your eye looks cloudy, feels like it's not clear enough. Am I right, Dr.
Yes,
K?
because the individuals, most times, they have what we call like a smoky vision. It will just look like a dew. Instead of seeing things clearly, it becomes blurry and smoky or foggy vision. That's what most of those individuals that have what we call cataracts come up with, to tell you that that's their experience or that's the way they feel.
Okay, so some people who feel that at times they turn and they feel like, oh no, it's because they get dizzy at times that they are seeing that way. You know, some people may attribute it to dizziness, like I just look and I'm just seeing like everywhere is just it's dizziness. Could it be that it's different?
Yes, very, very different. Because if there's hypoglycemia, the person can feel dizzy. lack of sugar in the system. Then you discover again if, like I said, hypoglycemia. Then persons who are diabetic too, at times, if the sugar level is high, they feel dizzy. So any other systemic thing can bring about that dizziness, and so on and so forth. But in this case, it's not a cataract that makes you feel dizzy, because most of the times, the symptoms, as I mentioned earlier, the person begin to experience so many things are not clear anymore. The way I used to see is no more happening to me. Everything is just fading out.
So like
And
anytime you see something,
it actually,
or is it that there's like maybe once today, like there was a time I was looking up and I didn't see it clearly, or it's that anytime you take up something to look at it, it's blurry?
no, those ones, intermittent loss of vision, are quite different from what we're talking about.
Okay.
Because cataract on its own develops through the years.
Okay.
Through the years. Because now, in that aspect of the development of cataract, most times it's expected that it occurs at with the elderly.
Okay.
People from like, call it almost 50 and above, depending on what could have led to the development. That's the natural way of cataract occurring or developing. But we now have rare cases where it could occur even in a newborn, what we call the congenital cataract, which abnormality that a child could have inherited from the parents as a result of gene dysfunction that occurred that made that child for the lens to be opaque. Then we now have other ones too that can result because of trauma. That's why everybody has to be careful. Blunt trauma to the eye, yes, it could result that. Then we have other systemic problems like diabetes. Diabetes can bring about early development of the cataract. So all these other problems, even use of medication, which sorry, I forgot to mention, use of medication like steroid. That's why self-medication is never good. Some persons go to the pharmacy or they demand that something is wrong with the eye, not using a prescribed medication. So all those things can lead to early development of the cataract. But apart from these ones that could break them earlier, is associated with the elderly most of the times. That's what happens.
Wow. Okay, so that's a lot to handle already. I think we just delved into the risk factors of cataract. What are the types of cataract? Cataract. Do we have types? What are the types of cataracts we have?
Most of the times, the major ones are called what we call the nuclear cataract. It starts from the center. If you observe somebody's eye or yours through the mirror, the middle of the black eye, which is the pupil. After the pupil, from there you'll be able to locate the lens, and if it's clear, it's practically very clear. So most of the times it can start from that middle of the lens and start becoming opaque. So now, being opaque, that opacity of the lens could result from the center of the eye. Then we now have the other ones, which we call the cortical subcapsular cataract. That one starts from the edges, outside edges, and starts coming inwards. So most times, those ones, the individual tend to see a bit better, pending when it finally closes up. Yes, then we now have the other ones, which we call posterior subcapsular, that develops from the inner out of the lens. And again, like I mentioned, then the traumatic cataracts that results because of injuries to the eye. Then the other one is now the congenital.
Okay.
Yeah.
So in all these types, can anyone be remedied?
Yes, very well, because cataract is one of the leading cause of reversible blindness, not irreversible, reversible blindness. Reversible blindness is what can be remedied and the individual tend to see again after the surgery must have been done. The irreversible cause of blindness, nothing can be done to them if any damage has taken place. So that's the difference. So one good thing about the success rate about having a cataract excision done could be that the individual will be able to see again, provided the back of the eye is actually healthy before the surgery. Yes. The
All
back
will
of
be
the eye.
checked.
Yes, the nerves and all that, the optic nerve, everything at the back, the disc, all was already healthy before the surgery was done. Because most of the times, when this opacity of the lens occurs, it's difficult for you to bypass, to check, for you to view the back of the eye. So these are the things that occurs. But most of the times when the cataract surgery is done, there's a replacement of the lens, which we call the intraocular lens, the IOL, is replaced with a damaged one for that individual to see again.
Replacement of the lens. Okay, we've gotten to that. Okay, this replacement, are we by any chance getting human lens? Or
No.
cow lens or goat
No.
lens?
No, that's why I said it's a reversible one. So it's a good one compared to some other eye problems like the glaucoma, which is
that's not
irreversible,
good.
can never be gotten back. Any vision loss can never be gotten back. So that's one advantage it has. It replaces again with the intraocular lens.
Yeah.
Is made and produced for humans to be used. And
Technologically.
yes, so that's the advancement. So many things are actually
So
taking
many
place.
things,
Yes.
yeah. So now we can actually make lenses that people use. Wow, that's a plus for technology.
Yes, there are times too, not just the intraocular lens. There are times too the contact lenses can be used,
Okay.
or spectacles. In those days, most times they make use of spectacles.
Okay.
And you discover that people will notice that this person is wearing a very thick lens.
Very thick one.
People call it Coke bottle.
Coke bottle lens,
Yes.
of course. But they used to look at them as the Efiko ones in school. They always, no, don't, these students are the Efiko students. Wow. Okay, at least something to hope on. At least technology has given us something to hope on, that this can actually be reversed.
Yes.
The reason why we still always keep talking about getting it checked.
Very well.
The reason why we always say getting your eyes checked. A lot of people are always very nonchalant about these things, and they just wait till there's a problem before you run to the clinic.
At the late hour.
And it always comes, and anytime you have to run to the clinic, that means there's already a late comma sign on it.
But we have some persons who...
No. What I mean by running, like emergency situation,
Yes.
it becomes a late comma sign on it. But when you find somebody, just say, okay, I think I have to go do my routine check, and you walk into the clinic and do it. Nobody will flog you. Try and be doing it at least once in a year or twice.
Yes.
Nobody's saying you have to go to the clinic every day, but at least walk into the clinic, check your eyes, check every other part of your body is very important. So we will go right on a short break. Don't touch that dial. When we come back, we'll continue with our topic, cataract. Welcome back to LJU on Radio Maria 91.3 FM, the voice of truth. It's another beautiful Tuesday, and we've been talking about cataract. With me in the studio is our guest and our friend, our very first guest on this show, on this LJU show, Dr. Kelechi Tabuko, who is an optometrist. She's been talking about cataract. She has given us an overview. What is cataract? It's a cloudy vision you see at times, the opacity of the eyes. She has told us about the types. We have the nuclear, cuticle, and posterior cataracts. She has also told us the risk factors, that for those who are above 50, you need to always get your eyes checked, and even before that, get your eyes checked. We have those who have congenital issues, probably from your genealogy, your genetics, the medications, those who are always on steroids, self-medications. Reason why we always say no to drugs, because you don't know where and what it's doing in your organs and your system. Also, for those who have some underlying ailments, if you have diabetes, hypertension, there are a lot of risk factors, complications that come with this underlying ailment, which makes you want to always check every other part of your body when you have these complications. So Dr. K, what can we say are the causes of the cataracts?
Yeah, a lot of things can cause cataract. Let's start with diabetes. Diabetes can lead to early development of the cataract, because once that blood sugar is very high, it also gets to accumulate on the lens, that makes it to develop a bit early. So that can bring an early development of cataract. And we also have the UV rays, which is the sunlight. That's why your UV protection is actually very important for you. So sunlight too can lead to that, constant staying on the sunlight without having your protection in place, your protection in place, it can lead to that. Then the use of steroid, which I mentioned earlier. Steroid is never a good thing. So to abuse medications can lead to development of cataract.
Dr. K, please let's stop on this steroid issue, because I can say that there are patients who are always, they recommend these things for them. Okay, when we're talking about steroids, we're not talking of the ones people do to have arms and chest and big chest and all that. Okay, now let's take it down to people who are ordinarily under those medications.
Long-term use.
Yes.
Long-term, that's the word. Long-term use. A doctor can prescribe a steroid for a patient, or for a short term,
Okay.
under restriction. So there are times patients are being given medication, you discover that they continue to make use of that medication without consulting their health personnel.
Yeah.
So that can lead to a lot of damages. That's why I used in quote long-term use.
So you're
So
hearing
any
those
doctor,
of you, don't come and say Dr. Kelechi, you're saying steroid is not good. Then your doctor gives you, you refuse to drink it, and then you remain sick.
we have eye drops, steroidal gods, yes, and also the systemic ones, the tablet. So that's why there is always a limitation in using those medications. And
You know that even apart from the eyes, steroids on a general, they reduce immunity.
very well.
They affect the immunity. So when they tell you say no to drugs, you know what they mean.
Yeah.
Because on a normal day, when you take steroids, you find yourself, every little thing that passes, you fall ill. We're not saying when you take it on medication, no. We're saying that when you find yourself in a long stretch that you can't live without it, it becomes an issue.
So that is why, and it's not in every eye situations that you dispense that steroid. So there are specific ones which you can dispense at that short term. The doctor recommends it for you, so use it at that time and don't go back without consulting your doctor. So that's the problem with that. I've seen
Sorry,
situations
Dr. K, let me call the phone lines again. 081 084 475 18. 081 084 475 18 to send in your SMSs, WhatsApp, and your calls. Would expect them now. Whatever, let's hear your complaints, let's hear your contributions and your observations.
So even our social habits can lead to it. Smoking.
Okay.
So that's why
Smokers are liable to die. Well, we've been hearing that since we were little.
so this cigarette actually causes a lot of
Okay, sorry, we
damage.
have a call coming in. Hello, good evening and welcome to Radio Maria 91.3. Good evening. Your name and where are you calling from, please?
Hello, can you hear me?
Yes, I can hear you, please. What's your name and where are you calling from?
My name is Hassan, calling from Jai.
From Jai.
Can you hear me?
Yes, I can hear you, Hassan, please.
Yes, please, I have a question to ask.
Okay, please.
And I'm a victim of eye problem. In the eye, I can give at times, I will stay on my own at times, I will be hearing that eye will pain me as if smoke has entered my eye. That is number one. Then the second thing, at times, at the eye, when I look at you like this, the eye, I will be looking at you, but you will be thinking that I'm looking at someone, which is as if the eye is not straight.
Okay. How old are you, please,
Yes, that is what
Hassan?
I want to ask. How am I going to go about it?
Okay, please, what age range are you so that when we're talking, when I know Dr. K needs it. Hello?
Yeah, thank
Okay,
you.
thank you, Hassan, for calling in. Dr. K, you heard this question.
Yes. Thank you, Mr. Hassan. The question here is, the first thing is that you have discovered that you have an eye problem. And the next movement you're supposed to do is visit an eye clinic for you to have your eye checked. Because now, if you're experiencing as if there's a smoke that entered your eye and with pains, so there are problems that stirs up and brings about these symptoms that you're experiencing. So you must have it to be examined. So if your eye is examined, the doctor will be able to diagnose and give you the right,
Proper diagnosis.
yes, and the right medication that you need. And another thing again, you said that if you're looking at someone else, like you're looking at another place. That's what we call a strabismus or squint.
Okay,
What people call it as quarter past eye. A lot of people tell you have this quarter past eye. So all those ones, I guess it has been there since you were born. And another thing again is that you'll discover that most of the times, why you're comfortable with yourself is because yours in the first place, you're not even experiencing double vision. There are a lot of persons with that squint or strabismus that you have. Most of the times they experience double vision, and it also gives them headache. So the best and the advice I will give you is go to the hospital, to the eye clinic, and get your eyes checked. Thank you.
Hassan, please, if you're still with us, you need to get your eyes checked. Go to the nearest health center or get any eye clinic, a good eye clinic around to get it checked. And thanks for calling in. I'm sure Dr. K has answered your question there. She cannot sit here and actually tell you your diagnosis. That is where she's actually not wanting to delve into diagnosing your eye from the station. But what she has been able to do is to establish and let you know that your eyes need to be checked up immediately. Thank you, Dr. K. We were on the causes and we were talking about steroids and why it's not too good for long-term medication.
And our social habit as well. You
Yeah.
mentioned it,
Yes, smoking, yes, that's what we
Yes.
stopped.
So many things, and a trauma. That's why you need to be careful. Most of the times when people fight, where they head to is your face or your head, and there are times unavoidable accidents.
Throwing of items.
All these
People
road
just
traffic,
get angry.
accidents. So we have a lot of things that could lead to that. So we need to take a lot of precautions whenever we're things that had to pertain with
Especially children, if you're hearing us, please be careful when you throw
I forgot to say
pencils.
there are so many. Even this
and
rubber lean
barrels, yes.
has led to a lot of
Oh,
children
really?
developing, losing the cornea, as well as even if the blunt items that they use to put on that rubber lean.
Yes.
So we discovered that we have had children with cataract as a result of what? Rough play.
Rough play.
Yes.
Children, if you're hearing us, a lot of children have had issues with their eye today not because they were born with it, but because of rough play. Not because it was intended to happen, but because it just happened. So you need to be careful.
Or mistakenly self,
Yes, you need to
even
be careful.
trying to discipline your child, even as a teacher, as a parent. So we have discovered even the use of cane to discipline the child. So you need to be careful whenever you're doing anything that has to do with the head. Yes, you need to take a lot of precautions.
Any object,
yes,
in particular,
because it is the window to the world.
Yeah. Without the eye, then I can imagine what it is like.
Yes.
You wouldn't see
at all.
Wow. Okay, so that's why we're telling you again, you have to care for your eyes. You need to take it seriously. You don't have to wait till you. Some people, they wait till there's migraine every morning and evening before they say, oh, it's like it's been long, I checked my eyes, I need to go check it out. Please find a time, a window period to always say, okay, within 6 months, I checked it last. Mark your calendars. And the issue we're having these days, a lot of technology has to do with the eyes. You need to look at your phones. There are people who don't get their eyes off their phones. There are people who don't get their eyes off their computers.
Yeah. And the
all
eye
that.
becomes fatigued. The eye is tired.
Very to the eyes, actually. I think it should be the most tired organ. External organ, because we make it look, especially these days, TV to phones to computers and all that. So how do you diagnose somebody who...
When a patient comes in with such complaint, the first thing you need to do is take the visual acuity. Visual acuity, the extent, to know the extent of what the vision the person comes in with. Most of those of you that have been to an eye clinic before, you will see the chart where you have those letters that are written there, and they will tell you to read. That's what we call the visual acuity.
You see, that chart is what keeps a lot of us away from the eye clinic. See, let's just tell you the truth now. You see that chart?
No, that chart.
Once we just sit down, this we will read that you just get tired. You see that chart?
Let me tell you, we have.
I'm talking for a lot of people.
We have seen
I'm telling you.
That's actually our legal document. When the patient comes in, it's one of our legal documents that need to be taken. You need to know the vision a patient comes into it.
Yeah.
Because there are times the patients will come in and tell you, doctor, I was seeing this, but now I'm not seeing it. You go back, you check.
You have to check the person.
And let the person know that this is what you were having when you got in, and this is what it is. So that visual acuity. Then another thing again in diagnosing it, then you discover that that person's vision is actually very poor. Unlike your 20/20 vision, where you have your 6/6 line, the patient barely even reads like a 660. That's if it has gotten to that and the real, what we call the mature and cataract. So their vision drops drastically because your inability to do your work is not giving you that room to do it anymore. You might not be able to see anymore. You might have difficulty and all that. Then the other thing that the doctor do again is what we call the dilatation, use of a medication. They'll instill an eye drop in the eye to dilate for the doctor to view properly, to be sure of what we're talking about. So this diagnosis can be used to identify a patient that has a cataract.
Okay, so these are the diagnoses. So what are the general symptoms on a day, like the symptoms I can be having? And okay, sorry, we have a call. Let's put it on hold. We have a call. Good evening, and where are you calling from? What's your name, please? Welcome to Hell Dare You on Radio Maria.
Hello?
Yes, please, we're hearing you. What's your name and where are you calling from?
Hello?
Hello, we can hear you.
Good afternoon.
Afternoon, we can hear you. What's your name and where are you calling from?
My name is Steve. I come from Kaduna. There's something I don't say, but maybe they should say that cataract, and I don't understand what is cataract.
Okay, you said you don't understand what is cataract. Hello, Steven. Are you still with us? Okay. Steven does not understand if I get his question.
Steven, let me come down to a layman's language like I used earlier. The mirror of your eye that makes you see me or see your friend or see your brother, see your sister. If that lens of your eye, which I use the word, I'm calling it mirror, instead of it being transparent for you to see, even when you get to the mirror now you want to see yourself, you discover that because that mirror is clear.
We have a caller. Yes, please. Who is on the line? Sorry. Good evening, and where are you calling from? What's your name, please?
Hello, it's Hassan calling back.
Okay, Hassan.
Yes, ma'am. And please, I want to ask if doctor will permit me to fix a date for me to see her on office. Honestly, I would be glad.
Okay, Hassan, after the program, we'll talk about that. Your number will be
And go
registered.
to any of the nearest general hospitals if you're in
You can access any nearest general hospital.
Hello?
Okay, Hassan, you can disconnect so that I'll be able to tell you what I want to tell you. Now, Mr. Hassan, if you're in FCT here, any of our general hospitals have an eye clinic depending on where you stay. Any of our general hospitals here in FCT have an eye clinic attached to it. Then we have some other private eye clinics, the ones that are closest to you too. So you can access your healthcare there.
Anyone you think it's even where you have anyone that you think it's proximity good for you, please make good use of it. Okay, so we're with Steven Kaduna.
Steven, so
neither the
if
layman's-
that lens of your eye or the mirror of your eye, instead of it being transparent, it becomes opaque. Opaque is something light, you cannot see through it. So that's what happens to you. That's what we call cataract, lens opacity or clouding of the lens.
That means you will not see with that particular lens.
Yes, you discover that you're seeing as if there's dew or smoke, the whole thing covering it. Yes.
Okay, so Stephen, I'm sure that answers your question from that view. So we're talking about symptoms, the general symptoms. What would someone?
Yes, most patients that have cataract come in with that poor vision, that smoky vision, dim vision, like I've described. Then everywhere becomes blurred, as if like a cloth covering it.
Okay.
So that's the way they feel, and it's worse at night. So under dim illumination, they will not be able to see.
That means even at night you may not see.
So most of the times that's what happens to those individuals. Then even the color starts fading. Instead of the color being as it is, starts to fade, looking lighter.
Another thing is the person may not know the color is looking lighter because it's the way the person is seeing it. Except of course you come and say this is peach, and the person is like, okay, maybe the peach is talking of is a light peach.
So
it's true.
Your inability to see things right,
yes,
occurs around that individual.
So don't think you are seeing it all clearly. You may just be seeing what you want to see or what you think you're seeing. That's why we say, please, from time to time, go and get your eyes checked, because when you go there now, they're particular about a color and they show it to you and you're not seeing it the way they want you to see it, then they will now say, okay, this is the problem. Okay, so we've talked about the symptoms and how do we manage it?
Yeah.
We manage the treatment and the management.
If it's at the early stage, the patient could still be managed by doing refraction, carrying out refraction on the patient, and possibly there's an improvement with lenses, spectacle lenses. Then it will be going to be dispensed. So use of glasses, if it helps that patient, then you'll be able to give out that patient for now, and the patient will be using it pending when no longer comfortable using it. Then another thing again is that also they need
with that patient's glasses, they also need to keep going to review it, right?
Yeah, that's what I'm saying. At a point in time, it might not help you anymore because you can't stop what is already developing. You can't stop it. Another thing again, light. Their lightning, you need to make it a bit better for them to be able to see the little way they can. So those glasses can still help them. Those it can help at that early stage. But the ones it cannot help, you'll not be able to do anything. Then the final this thing to it, treatment to it is surgery. Yes,
that's
surgery.
the last call.
Yes. At that time, then surgery will be carried out on that patient. Yes, after the surgery, the patients will be okay, pending if, like I said from beginning, if the back of the eye was healthy enough. Yes, before the surgery.
Is there any food? Because at times it's better for us to even try and stay healthy too than actually get it. Is there any food or anything that can just help us?
You can never stop.
Manage it.
We keep encouraging every human being on their fruits, their vegetables, fruits with your carotenes that helps you in your vitamin A, even vitamin E. So your fruits, your greens are very important to every human being. So
main greens, we mean ugu in this part of our world, cabbage and the rest of them.
A lot of them.
Yeah.
So we have a lot that actually help to be able to give us a lot of nutrients. Yet it might not stop it, but just that you might have a bit of a longer
managing
time.
it. Yes.
And your eye too, not just the eye, even the body is healthy. When the body is healthy, the eye too is also healthy.
That is the truth. That is the truth. That's why this program is bringing to our enlightenment. I think we also have this omega fatty acids, omega 3.
Yeah, that's why I said
Fish.
when I mentioned them. Okay, yes, your
From
food.
fish.
Yes,
yeah.
from your fish and all that your proteins
Yes.
that you take. Yes, they are very important.
Okay, it's been a lot to handle. I think we'll just take a stop a little so that when we come back, we'll wrap up the program and call it a day. So don't touch that. Welcome back to LJU on Radio Maria 91.3 FM, the voice of truth. If you're just joining us, we've been talking about cataract, and with me in the studio, I have a friend and a guest who, in fact, she was our first ever guest on this show, Dr. Kelechi Tabuko. She's an optometrist with the Buhari General Hospital. And we also have friends in the studio, our Reverend Sisters of the Eucharistic Heart of Jesus, who have come here to hear our word on the care of the eye. So we've talked about cataracts, the types, the risk factors. We've talked about the symptoms, the types, the diagnosis, and management and treatment. I know you'll be talking about the complications and all that, but can we just highlight it so that people will get to understand it?
After the surgery carried out by the ophthalmologist are the people that carry out this surgery. The ophthalmologist, the eye
Which
surgeons.
is the eye surgeon.
Yes, the eye surgeons carry out. So you discover that after the cataract surgery, you discover that there's inflammation, there's redness, and you feel pain, swelling of the lids and all that. They are normal with every human being, which you have done something on. Then the person discovered that maybe it might be because of all those swelling, like I said, swelling of the lid, and whatever it is that you experience. These are among the complications. Then there are times that see if the eye is closing, which we call the drooping of the lids after the surgery. But all these things, they return back once the eye muscles and everything is supposed to perform, doing their work properly. It returns back. These are just the early complications which you have. But the only thing that will encourage.
Sorry, we had a caller there. Okay, it's been cut off. Okay.
And the other thing again, that there are things that you don't need to do after the surgery. Some persons feel.
We have a caller, please. Good evening and welcome to Radio Maria. Yes, hello. Good evening. What's your name and where are you calling from?
Hello, good afternoon.
Yeah, good afternoon. What's your name and where are you calling from, please?
Hello.
Hello, yes, we can hear you. You're on air, we can hear you. Good afternoon. Okay, we lost our caller. Can we continue, please?
So I was trying to tell persons that after their cataract surgery, what they don't do. There are don'ts which you don't need to do immediately after the surgery. You're not expected to drive. There are some persons that they feel that let them drive. No, you're not expected. You cannot even drive with one eye. I forgot to tell us that this
Okay, sorry, we have the caller again. Good evening, and where are you calling from, please? Hello, can you hear me?
Good afternoon.
Yes, please, I can hear you. Okay, I think it's network issues, so
yes, I was trying to say something I forgot to say earlier. These cataracts can occur either one eye or both eyes.
Okay.
So if it happened that is on the two eyes, the surgeries will not be done at once.
Okay.
It's going to be done one after the other. I'd say they will do one after some time. They will now do the second one. So now the don'ts, you don't drive after the surgery, and you're not expected to wear makeup. I don't know where you're making up to.
Are you hearing
because
me?
Of the inflammations, and also because of the makeup you have can have bacteria, which the next thing you see, you discover the eye will get infected. So as at that time during the healing process, you can avoid wearing your makeup. And another thing again, you don't need to do no strenuous activity, so that the eye could take back its place. So the strenuous activity could affect the IOL, the intraocular lens that is being fixed. So you don't need to do that. Then swimming too, you avoid it. These are the early times where the cataract surgery has been done. So it's a healing process. So you avoid some of these things. And also, the most important thing is this: don't forget to put on your sunglasses. Your sunglasses shade you from light, because light is not good for any person that has done cataract or that early time that you're having the eye to be healed because of the inflammations. It could stir up inflammations, and then you have what you call a photophobia, which will affect you and can be very painful and red, so you will not be able to tolerate it. So the use of your sunglasses will always be encouraged for you, and don't rub your eyes. So these are just the few that I know I can mention.
See that last one? See that last one? It's very difficult to. Is there any alternative to that itchy eyes that
No,
you're not
rubbing. The itching is different. Itching is different.
Okay.
So if you're experiencing anything, that's why it's good for you to go back to your doctor and complain to your doctor.
Okay.
If anything, you're experiencing anything after the surgery. So it's very good. And it's a healing process.
Yeah.
So that healing process, within weeks and all that, you discover that the vision keeps becoming better and better.
Wow,
Yeah.
that's a lot. We've talked about a lot on cataract. Our time is fast spent, and Tabuko, just give us tidbits on how to stay away from cataracts.
Stay away.
How do we just not allow it to come near us?
No, you cannot stay. You
Hey.
stay away from it.
That's a
Everybody
problem
is
now.
aging.
Ah,
Yes, everybody is
this
aging.
aging of 18, at times you people will make us get so scared though, because it's like everything that comes on, they'll tell you it's about
Age.
aging, whether you like it or
There's
not.
no
age
how
will
we
catch
don't
up.
age. When you were born, we continue to grow. Things are happening and they start
But
depreciating.
it's the beauty of life.
Yes,
It's the beauty
until
of
we
life.
go back to where we came
It's the
from.
beauty of life.
So the age tells a lot. That's why, as you're aging, don't forget your activities, your exercise, what you eat, our social habit. So the things we need to do is take care of our body.
Stress. I think we missed that stress. Stress.
So your exercise is very important. Your fruits, your vegetables are important. You understand? So you
Okay.
avoid unnecessary
Let's take
things.
one last caller. I think our time is fast spent. Good evening,
Hello.
and where are you coming from, please? Yes. Please, can you hear us? I think you've been trying
Hello.
to call in. If you can't, you send a message. Hello, can you hear us?
Yes, good afternoon.
Yes, please. Your name and where are you
I'm
coming from?
calling from Apo. I just tune in now. I don't know if you can, maybe she can say, to tell us about the symptoms of the cataract they are talking about.
Yeah,
Okay,
the
sure, we'll
symptoms.
do
The
that.
person comes in not
Thank
seeing
you.
clearly.
Thank you, Godson, for calling in.
Thank you, Mr. Gosling, for that. The person comes in not seeing clearly, as if he has a smoky vision, like a cloth covering it. He's not seeing very well. Things are like covering the way that which you see, what we call dim vision. So if you have such complaint, those are the things the person comes in with. The person might not even talk about pain. Cataract doesn't give you pain. The only thing like is the trauma that can bring the early development of cataract. But cataract doesn't give you pain. So understand that. So it's the person's vision, is what the person feels and experiences, is what the person tells us. Thank you.
Wow. Okay, thank you. So it's been a whole lot. We've talked about cataract, and she just mentioned it all again. When you start having blurry vision, that's what cataract is actually, cloudy vision. From what she has taught us, Dr. K is more of even a lecturer than a practicing person, because when she comes like this, the way she dissects everything down for even me, that's cataract. Okay, what is it? What is it? I think today I've learned a lot. She's told us that cataract has different types. We have the nuclear, the cuticle, and the posterior type. Can be caused by blunt trauma, can be caused by congenital issues. Some people are born with it. Medication, steroids, and long-term use of steroids actually. So always work with your doctor's prescription. She talked about diseases where you have diseases like diabetes, high blood pressure. It's something that should every now and then make you see your eye doctor, and in fact any of your other doctors, to make sure that it's not really, because like she said, the blood sugar, it's you can see it's like an accumulation in your eyes and all that. So it's something you need to get checked out. We also talked about the treatments that luckily and gracefully, unlike her first topic she gave to us, that day we almost fainted here, glaucoma. Today she has told us that this one is reversible. Okay, so there is hope. Technology has advanced to that extent where you can replace the lens actually. So It's not the end when you're diagnosed of cataract. It's never the end when you're even diagnosed of any disease. Your psychology, first of all, is to have the faith that you would get better and it will work for you. So cataract is reversible. Yes, if you can hear us, she said it is, insofar as you take the right steps, go to your clinic, and they follow up on it. Yes, another thing would always, what are the lifestyle? Make sure you check your lifestyle. It's very important, whether for the eyes, for the tooth, for the ear, for the head, for any part of your body, for the liver, for the kidney. Everything revolves around your lifestyle also. Eat healthy fruits and vegetables, very important. Your grains, food that contains vitamin A, your omega acid foods, your fish. Take note of this food. And remember, while you are aging, whether you like it or not, if you like, use all the anti-aging cream in this world. The anti-aging cream will not change your internal organs. It will not change the organs lifespan that you have used in those years. So whether you like it or not, age is coming to everybody. Whether you say it or you don't say it, it will tell. So you have to be careful as you're aging. Like she has said, exercises, even if you have to go to somewhere that is close by, take a walk. Yes, we may say the country is not safe, but at times there are places you can access easily walking down there. Exercises, she said, can never be overstretched. Also, stress, please reduce on the stress. The wahala in this country is too much. We all know, but we will not kill ourselves. We will continue to thrive. God will continue to see us through. And then when you have a cataract surgeries, do not drive, do not wear makeup, no swimming, no strenuous activities. If you have to stay indoors, stay indoors. If you have to come outside, use your sunglasses. Protect your eyes from the UV rays. I think even not just for those who are cataract prone, but every other person.
Yes,
Better for us too, because our eyes these days are exposed to a lot of rays. So Dr. K, can we get one? So sorry, before I come to you, Dr. K, Sister Martha, you've been with us and we just actually you've been following us. So just give us one word, even if you tell us pray and live healthy, it's fine. Let's just have one word from Sister.
Thank you, Dr. K, for the enlightenment. I would like to advise our listeners, if you have any issue, run as fast as possible to the hospital. Go and see the eye doctor. Because if you delay, it might result in greater problem. I have had to live with somebody with cataract for 7 years, went to various hospitals, they say it was a write-off case, but with God's intervention, at the 7th year, the surgery was done and he was able to see again. So if you have any issue with your eye, don't delay, don't waste time. Go as fast as possible to the nearest good eye clinic, not just anyhow eye clinic. Thank you very much.
You heard it from Sister. Sister is a seasoned administrator and education. So if we keep her here, she will talk and tell you what to do and what not to do. So you've heard it from Sister. Dr. K, please, your last word.
A stitch in time saves 9. Do what you need to do at the right time you need to do it. Don't allow it to be too late, where no help or nothing can be done, because doctors can never perform magic. Thank you, listeners.
So you've heard it. It's a wrap for the day. You've heard it, and we want you to live healthy, stay healthy, and act healthy. Join us again next Tuesday for your very beautiful, delightful program that brings you general healthy well-being. Healthier You on Radio Maria 91.3 FM. It's a wrap, and child protection is next on the show, so do not touch that dial. Thank you.